Hi, my name is Brenda. I'm here from Northwest Indiana. I was originally diagnosed with Lyme disease back in the end of September. I was being treated at home by my naturopath, and for about a month I took off work, and I thought I was doing pretty well. I went back to work for another month, and all of a sudden my symptoms began to decline majorly. I continued treatment at my naturopath for probably another 2 months, and at that time she just felt like I was being a little bit more difficult than what she could handle, and so then she sent me here to Dr. Minkoff. At the time I had lost over 20 pounds, and I was really afraid of dying, and when I came here, Dr. Minkoff assured me he was going to be able to help me, and he has. I gained more weight after I continued for a short time to lose weight, but I feel like now I'm getting stronger, and I'm just much more alive again, and I've been able to exercise, which was a big part of what I was doing before I was diagnosed. That really hurt me. I couldn't exercise anymore. So I actually have been here for 3 months, and along with my therapy, as Dr. Minkoff was diagnosing and seeing me for visits, at my third follow-up visit, he had identified that I had some issues with some scars. And so I had actually laughed when he said it, because I couldn't really remember any major surgeries I had had. I had had an episiotomy when I had my only child, and I had had trouble getting pregnant, so I had a laparoscopy just as a exploratory to find if I had any endometriosis, which they didn't find any. So it was kind of one of those where I really didn't need that surgery, as I was sick or anything. But it's interesting that what happens is when you have scars, it actually affects how the nerve can actually give off its electric impulse. And so what happens then when you have other diseases that occur, especially Lyme disease, which likes to attack the nerves, it actually started affecting how my discomfort was occurring in my body. So what happened, of course, because I trusted Dr. Minkoff, I said, well, okay, I guess if you guys say that's what it is, if that's number one thing that's showing up, let's go for it. So Jen Bayer, the nurse practitioner, she actually is the one who performed the procedure, and my laparoscopy scars were so small that we could hardly find them. But after the procedure was done, I went home, and that evening I said I experienced 3 hours of a miracle, because I felt totally cured. I didn't feel any pain or discomfort anywhere. And, eventually I did have some of the symptoms, come back, but for the most part, I know that one day I will feel well again. We just have to continue to treat the areas, which many times it does take more than one time to do it, but not always. And for what I went through, the 3 hours of my miracle, I would do that every day. So if anybody ever thinks twice, I totally recommend it. It sounds like a silly procedure, but once I thought about what the physiology is of it, it totally makes sense. And I can see where many different diseases that are misdiagnosed, that are truly just autoimmune problems that are related to the gut, many times could have problems with the nerves, how they interact, and that's what's causing their discomfort. So I recommend the neural therapy. Thank you.